So today is our last lecture regarding the Neoplasia chapter. So what we are going to discuss today is the clinical aspects of the Neoplasia. In this we have both malignant and benign tumors cause problems because of the location and impingement on the adjacent structures. Functional activity like hormone synthesis or development of the paraneoplastic syndrome, bleeding and infections due to the ulceration of the tumor through adjacent surfaces, symptoms due to the rupture or infarction, and cachexia means wasting. So there is a local and hormonal effects also happen in the neoplasia. There is a cancer arising within or metastatic to an endocrine gland having endocrine insufficiency. The hormone production seen in neoplasm arising in endocrine glands are more typical of benign tumors, and the neoplasm in the gut causes the obstruction or intussusception. Intussusception, you might have known the term. The non-endocrine tumors may elaborate hormones or hormone-like products which called as paraneoplastic syndromes. The melena and the hematuria, the characteristic of the neoplasia पर gut and urinary tract, यानी इस जगह पे gut और urinary tract में जो भी neoplasm होगा उसमें melena होगा gut system में and hematuria होगा same symptom है urinary tract. Paraneoplastic syndrome. The symptom complexes in cancer-bearing individuals that cannot readily be explained either by the local or distant spread of the tumor or by the elaboration of hormones indigenous to the tissue from which the tumor arose. ठीक है बेटा? What is the significance of paraneoplastic syndrome? These may present the earliest manifestations of an acute neoplasm. They may present significant clinical problems in the affected patients and may mimic metastatic disease, which may complicate the treatment. Endocrinopathy like ectopic hormone productions in just, for example, in Cushing syndrome, which is the most common endocrinopathy and occurs in 50% with small cell carcinoma of lungs due to the excessive corticotropin production. The second one is the hypercalcemia. The most common paraneoplastic syndrome is the two processes involved: osteolysis induced by the cancer and the production of the calcimic humoral substances in extraosseous neoplasm. यानी bone का जो neoplasm होगा, other than that, production of calcium humoral substance in calcium वहाँ पे प्रोडक्ट होना शुरू हो जाएगा bone के. The third one is the acanthosis nigricans, the gray plate patches of the verrucous hypokeratosis on the skin, the genetically determined juveniles or adults. Juveniles mean छोटे बच्चे और उसके बाद adults में. These are the pictures of the acanthosis nigricans. These black spots here, the elbow, in the back. Okay. What is cancer cachexia? The progressive loss of the body fat and lean body mass accompanied by profound weakness, anorexia and anemia. There is also weight loss, results equally from loss of fat and lean muscle. अच्छा, there is a weight loss results equally from the loss of fat and lean muscle, and these occurs due to the increased basal metabolic rate despite reduced food intake. Although there is a anorexia यानी लॉस ऑफ एपिटाइट होगी उसमें कैंसर पेशेंट्स में और उसके अलावा बेसल मेटाबॉलिक रेट जो होगा बीएमआई वो भी बढ़ा हुआ होगा इसीलिए जो होगा कैंसर की केक्सिया. Now the laboratory diagnosis, the histologic and cytological methods. Sampling approaches क्या होती है? Excision or biopsy. There is a quick frozen section desirable, which determines the nature of a mass lesion or in evaluating the margins of an excised cancer. Excision and biopsy. Then comes the fine needle aspiration, the aspirating cells and attendant fluid with a small bore needle used for more readily palpable lesions in breast, thyroid, and lymph nodes. It is less invasive and more rapidly performed. So this is the, what is this? This is the fine needle aspiration. यहाँ पे होगा थायराइड नोड्यूल्स में और ये ब्रेस्ट नोड्यूल्स में. ठीक है बेटा. Then comes the cytologic or pepinicular smears. They screen for cervical carcinoma and also endometrial carcinoma, bronchogenic carcinoma, bladder and prostatic tumors, and gastric carcinoma. For ID of tumor cells in abdominal, pleural, joint, and cerebrospinal fluid. साइटोलॉजिकल स्मेयर जो होंगी वो हम लोग इन न्यूप्लाज्म में यूज करेंगे. जैसे ये है, ये नॉर्मल सरफेस है, सर्विक्स बिल्कुल रेगुलर उसकी जो है मार्जिन्स हैं. उसके बाद सर्वाइकल डिस्प्लेजिया, ये डिस्प्लेजिया, ये देखिए ये इस तरफ आ रहा है डिस्प्लेजिया. और हिस्टोलॉजिकली जो ये था उसका ग्रॉस मैक्रोस्कोपी, and these are the microscopic. The normal cervical cells look like that, and the cancerous or precancerous cervical cells are looking like that. These are the cytological pictures of the. Now the immunohistochemistry uses the categorization of differentiated malignant tumors, the cytokeratins used for the carcinoma, and desmin for the muscle cell origin neoplasia. Uses is used to determine the site of the origin of the metastatic tumors. It detects the tissue-specific or organ-specific antigen in a biopsy specimen of the metastatic deposit, PSA. So it is used to detect the molecules that have prognostic or therapeutic significance. Just for example, there is a detection of the hormone receptors in breast cancer cells of prognostic and therapeutic value. Flow cytometry क्या है? These are rapidly and quantitatively measures individual cell characteristic. For example, membrane antigen, DNA content of the tumor cell. इसमें हम लोग membrane antigen को evaluate करते हैं और DNA contents of the tumor cell. It is useful in ID and classification of the tumor arising from the T cell and the B cells and from mononuclear phagocytic cells. Molecular techniques कहाँ पे यूज होती हैं? In the diagnosis of the malignant neoplasm, prognosis of the malignant neoplasm, detection of the minimal residual disease, and the diagnosis of the hereditary predisposition to the cancer. Now, the tumor markers. These are the biochemical assays for tumor-associated enzymes, hormones, and other tumor markers in the blood contribute to detection of the cancer. These are useful in determining the effectiveness of the therapy or appearance of the recurrence. यानी इससे हम लोग ये भी पता लगा सकते हैं कि जो हम लोग थेरापी दे रहे हैं पेशेंट को वो कितनी इफेक्टिव है और रिकरेंस के कितने चांसेस है. क्लिनिकल ट्यूमर मार्कर्स जो यूज होते हैं लंग कैंसर में जैसे यूज होता है CA-125 and CEA. लीवर में AFP, प्रोस्टेट कैंसर में PSA, टेस्टिकुलर कैंसर में AFP SCG, ब्रेस्ट कैंसर में CA125 CEA HER2, stomach में CEA, pancreas cancer CA125 CEA, colonic cancer CEA, and the ovaries cancer CA125 CEA. Thank you. That's all for the today and from the Neoplasia. Any question, beta? Please write down your question. Yeah. I can see your questions. लेक्चर जो खत्म थियो ठीक है हाणे अनम्यूट कयोन त क्वेश्चन वगैरह कन
रिकॉर्डिंग बंद क्या रिकॉर्डिंग बंद क्या ना